Hey everyone, and welcome to Visual Depicts Med. If you're new here, our whole goal is to break down these really complex medical subjects using detailed animations. We want to make them easier for everyone to grasp, whether you're a medical student or just curious. Today, we're heading to the very gateway of the digestive system. We are taking a deep dive into the anatomy of the buccal cavity. So here's our roadmap for today's journey. We'll start right at the entrance, defining the buccal cavity, before taking a really close look at the lips. After that, we'll explore its two main spaces, the vestibule and the oral cavity proper. Then we'll get into the teeth and tongue, and to wrap it all up, we'll see how this anatomy plays out in the real world with some clinical examples and a quick review. All right, let's get started. The buccal cavity, or, the mouth, is the very first part of our digestive tract. It's a busy place, playing a huge role in speaking, breathing, and of course, getting our food ready for digestion. It's split into two main areas that we're going to explore, an outer space called the vestibule and the main event, the oral cavity proper. So, to get technical for a second, the buccal cavity is the space that's walled off by the lips and cheeks on the outside. Its ceiling, or roof, is the palate, and the floor is that powerful muscle, the tongue. And inside all of that, you've got the teeth and gums. It's a pretty complex space, so let's start our tour right at the front door. The lips, or labia, are these two fleshy, super mobile structures that act as the gatekeepers to the mouth. You've got skin on the outside and a mucous membrane on the inside, and they are absolutely essential for eating, talking, and all our facial expressions. Their outer surface is marked by some really important landmarks. Okay, so what you're seeing on screen now is a great view of those key external landmarks of the lips and the area around them. We're going to go through each of these one by one, because knowing their specific names and where they are is fundamental for any kind of clinical exam. Let's break this down. See that shallow vertical groove running from the bottom of your nose to your upper lip? That is the philtrum. Right below it, you've got a little fleshy bump called the labial tubercle. Now, the reddish part of your lips themselves, that's the vermilion zone. It's packed with blood vessels, which gives it that color. But fun fact, it doesn't have oil or sweat glands, which is exactly why our lips get chapped so easily. The sharp line that separates that red area from your skin, that's the vermilion border. Over at the corners of the mouth, we have the labial commissures. And sometimes you might find a tiny little pit right in the corner. That's a commissural lip pit, just a harmless little leftover from development. Now that we've covered the entrance, let's step just inside, past the lips. We're now in the first major space of the buccal cavity, the vestibule. You can think of this as the entrance hall, or the lobby of the mouth. So, what exactly is the vestibule? Well, it's that space between your lips and cheeks on the outside and your teeth and gums on the inside. You know when your mouth is closed and you swish mouthwash around, you're swishing it in the vestibule. Understanding the vestibule's boundaries is really key. So, in the front, it's bordered by the lips. On the sides, the cheeks, and on the inside, the teeth and gums. It opens up to the outside world through the oral fissure. That's just the gap between your lips. But what's really cool is how it communicates with the main part of the mouth. It does so through the little spaces between your teeth and also behind your very last molar. Okay, passing through those spaces between the teeth, we are now entering the main chamber of the mouth, the oral cavity proper. This is where most of the magic happens. This is the space that lies inside the arches of your teeth and their surrounding gums. It's the home of your tongue, and it's where the real work of chewing, mixing food with saliva, and starting digestion really kicks off. In fact, when your mouth is closed, this whole space is pretty much filled by the tongue. Just like the vestibule, this space is defined by its boundaries. The roof is the palate. You've got the bony, hard palate up front, and the soft, muscular palate in the back. The floor is the muscular tongue and the tissue right underneath it. The lateral and anterior walls, those are the inner surfaces of your teeth and gums. And in the back, the posterior boundary, it opens up into the oropharynx. That's the part of your throat right behind your mouth. That opening is called the oropharyngeal isthmus, or the facies. So now that we've mapped out the space of the oral cavity proper, let's zoom in on what's inside. The two most obvious structures, of course, are the teeth and the tongue. Our teeth are set into the upper maxillary and lower mandibular arches, and their main job is mastication, fancy word for chewing. Humans actually get two sets of teeth in their lifetime. First are the 20 deciduous teeth, or baby teeth. These are eventually replaced by the 32 teeth of the permanent adult dentition, and when they're closed together, they form that all-important barrier between the vestibule and the oral cavity proper. The tongue really is the muscular floor of the oral cavity proper. It's an incredibly complex organ, and it's vital for everything from tasting our food, to moving it around while we chew, to swallowing, and of course for speech. The top surface is covered in little bumps called papilla, which is where most of our taste buds live. It has a freely moving body that ends at the tip, or apex, and a base that's anchored to the hyoid bone, forming the front wall of the oropharynx. Okay, so we've gone through all this anatomy. Now let's connect it to clinical practice. Because understanding the normal structure of the buccal cavity is the absolute first step in being able to recognize and diagnose when things don't go according to plan. Here we're looking at a case of a cleft lip. This is a fairly common congenital condition, and it happens when parts of the face don't fuse together properly during embryonic development. It occurs in about 1 in every 1,000 births and ties directly back to the anatomy of the philtrum and upper lip that we talked about earlier. Here's another common variation you've probably seen: a diastema. That's the gap between the two upper front teeth. It can have a few different causes, but one of them is an unusually large superior labial frenulum. That's the little fold of tissue that connects the inside of your upper lips to your gums. If it's too big or attached too low, it can physically prevent the teeth from coming together, and sometimes it requires a minor surgery called a frenectomy to fix. And hey, remember those commissural lip pits we pointed out at the corners of the mouth? Here's a really clear clinical photo of them. These are simply harmless little leftovers from development. Unlike a cleft lip, these aren't clinically significant at all, but they're a great example of an anatomical variation you should be aware of during an oral exam. All right, let's do a quick recap. This table gives us a great summary of the key boundaries for both spaces we talked about. For the vestibule, you've got lips and cheeks on the outside, teeth and gums on the inside. For the oral cavity proper, the teeth and gums are the walls, the palate is the roof, the tongue is the floor, and the oropharyngeal isthmus is the back door. Take a second to let that sink in. Okay, time for a few practice questions to see what's stuck. Question 1. The shallow vertical depression from the nose to the vermilion border of the lip is known as the A. Labia tubercle, B. Philtrum, C. Vermilion zone, or D. Labiomental groove. The correct answer is B. Philtrum. Yep, that's that distinct groove right in the middle of your upper lip. Question 2. The oral cavity proper communicates with the oropharynx via the A. Oral fissure, B. Vestibule, C. Oropharyngeal isthmus, or D. pterygomandibular raphe. Think about that posterior boundary. And the correct answer is C. Oropharyngeal isthmus, which you might also hear called the fauces. That's the back exit of the main oral cavity leading into the throat. And our last question: which space is located between the teeth and the cheeks? Is it A. Oral cavity proper, B. Pharynx, C. Sublingual space, or D. Vestibule? The correct answer is D. Vestibule. Remember, the vestibule is like the lobby that's outside the dental arches, while the oral cavity proper is the main room inside. And that officially wraps up our detailed tour of the buccal cavity. We really hope this explainer helped clear up the complex anatomy of this region. What part of oral anatomy do you want us to cover next? Let us know down in the comments. Don't forget to like, subscribe, and comment for more medical animated topics from Visual DepictsMED. Thanks for watching.